Hello, loves. Okay, I am attempting this again. Thank you for your patience. We are live. So happy to have you join me. For those of you who I haven't had the pleasure of meeting yet, my name is Jeannie Aegis. I am a former corporate escapee, founder of Self-Care Journey Coaching, and also this beautiful tribe of women and every woman self-care coach. I'm also a certified health and wellness life and success coach, and I am dedicated to serving and elevating women's self-care practices to recharge their energy, release emotional weight gain, and also reclaim a healthy lifestyle that they absolutely love. And every month I have the pleasure of inviting and interviewing amazing women who are the experts of their field in wellness. And today I am so grateful to have Dr. Meg Mill join us. So she is a functional medicine health consultant and a clinical pharmacist. She sees patients in her virtual functional medicine practice, healing the root cause of their health struggles through advanced diagnostic testing and personalized support. And today I've invited her on, and I'm going to invite her right now. We're going to talk about the importance of gut health, how to optimize your health and your life by really getting to the root of it. So I'm going to add her on. I'm so happy to have her join.
Hi, Jeannie.
Hi, how are you?
I'm good. Thank you so much for having me tonight.
Thank you for joining. Thank you for being so patient. A little bit tough technical difficulties, but I'm so happy that we're here. And I'm excited to dive in and ask you some questions. But first, I would love for you, to just provide an introduction. Anything that I've missed, I would love for you to share with us.
Yeah, great. So as she said, I'm Dr. Meg Mill, and I have a virtual functional medicine practice where I see patients. And with functional medicine, we really dig into the root cause and figure out why things are happening. I spent many years in conventional medicine and I just kept seeing so many people getting more and more sick and just seeing medication being placed on where they were really just living, not thriving. And so it really made me take a hard look at where I wanted to be. And I made the choice to go back and get a certification in functional medicine through the Institute of Functional Medicine and the School of Applied Functional Medicine to make a shift in my career and really bring in wellness and at the core and really dig into the root cause. And so what we do is we look at each person as, I say, a case study of one and see because what your imbalances are different than my imbalances, and each one of us are unique. And so we really dig into, do a lot of testing and personalized support of what's going on and how we can help each person, feel their best.
That's incredible. I mean, I love what you do. I love everything that you said. And I love the fact that you really take on a very customized and personalized approach to every individual. And like you said, everyone's different. We're not, we're all made the same. And some of the root causes that may be happening in my body may be different in yours. So I love what you do. And I want to congratulate you for making that transition as well, right? It probably wasn't easy, but you did. You followed your heart and your passion. And I can totally understand, but that's how that feels like. But, congratulations. I'm so happy that you're here helping the women that you do.
Thank you.
So what really led you on this path here today? Like, was there something in your journey really that really led you here exactly in this moment?
Yes, actually, that's a great question because my journey sort of started from a professional and a personal angle. So from the time I was about 23 years old, so we're talking about the gut today. I had gut issues where I would eat things and I just never felt well. And we couldn't figure out, they tested me for celiac, but then I got this label of IBS slapped on me. So I actually hate those three letters because anyone that has has an upset stomach, bloating, constipation. We all react differently to foods. And I feel like whenever people can't pinpoint what it is, they just slap like, oh, you have IBS. And they said, you're sent on your way. So I spent years trying to figure out, what was going on. I was told, oh, you're healthy and everything's fine. And meanwhile, I don't feel fine. I don't know when I eat, what's going to trigger me. And I just was having so much trouble figuring that out. So I jumped around from different gastroenterologists, a lot of alternative medicine. And it just kept feeling like everyone was giving me just like a piece, but not really figuring out what the issue was, and I wasn't treating it. It was just sort of like, and then you get confused because you have all these different people just saying like this and that, and you're floating around. And here I am in medicine also, but when it's your own self, it's a little bit, you know, different. And so I just kind of felt that journey of feeling like, so I've been there, I feel lost and needed some support. So then I found I had a relative that was in functional medicine. Was going to a functional medicine provider. And she said to me a few years ago, you know, I felt like for the first time in 20 years, I finally feel well. Someone finally figured it out. And so I started looking into functional medicine because I was already looking to make a change into a more of a natural, holistic health field. And whenever I started researching functional medicine, because it's actually fairly new, the Institute of Functional Medicine just celebrated its 30th birthday this year. So a lot of practitioners are from the conventional space that move into a more holistic area. But I really started researching that, and I thought, wow, this is the perfect fit. So then in that process, I was able to heal. I was my first patient. So I was finally able to heal myself and feel amazing and feel so much better. And when you find that, the other thing I would say is there's an educational piece, at least that I like to provide with my patients, because I'd like to, in addition to just treating them, really give them the knowledge of how they can continue this, because my goal is to have you not only feel better, but stay better and know what you can do for yourself in order to make that happen.
Of course. That's amazing. I mean, you sound so amazing, and I know that you are. And, you know, some of the things that we go through in life, it's funny how we end up, like, we go through and we don't understand why we're experiencing it. And then we end up healing ourselves. Yes. And because of that, we end up where that's the reason why. In that moment, we didn't see it, but now we know that there's a purpose for it. And now you're able to help, you know, other women, and, you know, not only just find the root of it all, but also build that sustainability afterwards so that they can feel good afterwards as well. So I'm getting some comments here about just, you know, a great example and reminder to heal yourself at the same time, right? So it's so lovely. So I wanted to ask you, like, if we were to get into gut health, which is what this topic is, right? Which is what I'm so excited about. Like, why should we care about gut health? Like, for those who are like, you know, what is that? I feel like it's not talked about enough.
Yes. And actually you need to care about your gut health, even if you're not feeling symptoms of having issues with your gut or your GI system, because the gut is the way you're going to absorb, you know, in order to get nutrients. So you can eat healthy and you can really make an effort in a lot of ways, but in order to actually absorb the nutrients in your body, you have to be able, you know, you have to first eat them, then you have to be able to digest them, and then you have to be able to absorb them and get them into your cells to actually get the nutrients that you want. So if you're making the effort in, you know, taking that effort to eat healthy and, you know, eat the right things, but you're not actually digesting and absorbing well, you're still going to be nutrient deficient. You know, and then there's like two other components where this is like kind of a surprising fact, but that like over 75% of our serotonin is actually made in the gut too. So there is a gut-brain connection, and the vagal nerve connects the gut and the brain. But, you know, you think of the stress in your stress affects your gut, but your gut also affects your stress and your mood. So, you know, it's important for that. And a lot of our immune system lies in the gut. So for overall immunity, immune health, prevention of autoimmune disease, or even treatment, if you're in that space, are all very important. Gut health is central to all those factors. So it really is. And sometimes in functional medicine, we say all disease begins in the gut because of that fact, and of the fact that that's the biggest transport of how we, you know, in some ways interact with the outside world, because that's where we're taking in things into our body.
Wow. Yeah. And I mean, we're triggered by a lot of things when it comes to stress too, right? So you said that everything kind of starts from the gut. I mean, that is definitely where people should kind of start from, because stress is all around us and we can't avoid it, right? And we are hit with so many physical and mental stressors, but I mean, if it sounds like we don't take care of our gut, no matter what we do outside of it to help the stress management, it's still not going to be doing the full thing, right? The full deal, because so much of it is controlled by the gut, right?
Yeah, and it kind of goes both ways. So you have two different nervous systems in your body. You have and like simplified, you have two different. So you have a parasympathetic nervous system and you have a sympathetic nervous system. So your parasympathetic is when you're calm, you're relaxed, and that is labeled. We call that rest and digest. So that when you're calm, you can actually digest your food better. You're in that space where your body is intending to rest, it's intending to digest, you're getting optimal digestion. So if you're stressed all the time too, this is the other element, is that you're in the fight or flight stage. And in our body is in that fight or flight stage, we have to react. So it's going to send all of your blood to your limbs, your pupils dilate, you get like, okay, I'm reacting. And our bodies haven't evolved enough yet to understand that you're like, oh my gosh, I have so many things to do tomorrow. Your body still thinks the lion is chasing you. It's different. So it's feeling that stress response. So then you're not, so it kind of can be a cycle for people, because, you need to have good gut health to get the right, for some of that, but then also some of that stress can cause problems with your gut health. So we kind of do a two-pronged. I always work with people too on, managing that aspect. It's important to.
So good. Yeah, I had some comments come in that they said that they didn't know about that, and people tend to think that as long as they eat healthy, that they're already fine. Mm-hmm. I mean, a lot of it is nutrition too. But they don't really know about the gut functionality. So yes. I'm happy. I'm so happy that this was so timely, because I think with what we've been through the last year and a half, and everyone just coping with what they've been dealing with the stress. So it's just so important to really, really kind of get deeper, mm-hmm. right, into what they need to do and start looking at all ways that they can feel better.
Yes.
But for someone who wants to have a healthy gut, how can they start? What is something that they can do, like maybe like top 5 that they can kind of like start looking at on how to get a healthy gut?
Mm-hmm. So it's a little bit tricky, because it is, it's different for each person a little bit. So, some things, and I think that's kind of where it gets into that root with functional medicine, is everybody, mm-hmm. There's not sort of one way that works the best for everyone. But I mean, I think eating a rainbow is always a good idea. So you want to try to get different servings of, if you can aim to get 2 servings from each color of the rainbow every day, that gives you a wide variety of nutrients to get in your diet. So that's just like a little easy trick to get the variety of nutrients. Then so prebiotic foods are important, and we're learning more and more about the importance of prebiotics. You can take a probiotic, and the probiotic will populate the gut in, you think of the gut sort of as your lawn, and you want your lawn to be full and lush and nice, and the microbes the good microbes in your gut are your nice, good grass that you're intending. And whenever that gets too thin, or something triggers it, or whatever, those weeds go through. And we want, and then the weeds that come through are the bad bacteria that's in the microbiome, what we call dysbiosis. Mm-hmm. So taking that probiotic will help build that good bacteria, so you can't, you can't get overgrowth of what we don't want. Mm-hmm. And then prebiotic foods, which would be some of your fermented foods, like the kombucha and sauerkraut and different things that help feed those probiotic the microbes.
I eat a lot of kimchi. Does that count?
Yeah, that counts. Yes, exactly. Okay. That's it. You got it. So you're good. But we're getting those. Now, when I say this, though, some people, depending on what you have going on, can be sensitive to some of those foods. So those are just good starts. The other thing is that I really think is that, if you think you could have a food sensitivity, try to just eliminate it for 4 weeks and see if you can tell any difference. Food sensitivities are hard because they're not always specific. It's not like, oh, I eat this, I get an upset stomach. You can feel like, joint pain, headaches, eczema, different, like where you're getting skin issues. You can just feel brain fog, fatigue. So until we really dig into some of that, it's hard to identify. But if there are any foods that you think you could be reacting to, just try to eliminate them, and then you can reintroduce them, after about a month and see if they affect you. I was talking with one of my patients that we wanted him to eliminate dairy, and he never would have thought dairy was a problem. Never. And I'm like, just try it for me. We're working through this. And then he's, once he eliminated it, then he had it this week. I was talking with him, and he's like, I ate that. And as soon as I ate it, I was congested again. And I was like, see, now you know. And then you can make the choice, but right. And until you actually do some of those things, you can't see the difference.
So it's like kind of like a process of elimination, depending on.
Well, yes, we do. I do food sensitivity testing, so we can actually run some testing to see if you can find out the exact foods that you're sensitive to. But you also can just do elimination. You can search up an elimination diet online. There's probably, I'm sure you can find layouts of different elimination plans that you can try.
Yeah. And does it change as you get older? Like as you get older, does it become like, because your body changes all the time and evolves. So it's like when things come up as you get older, does your gut kind of deteriorate? And it's like constantly you have to do testing?
So you do get less stomach acid as you get older. So this is the surprise is that you actually do need a good amount of stomach acid to digest your food, because we think of stomach acid as being a bad thing. And we think, with the abundance of proton pump inhibitors now that people are just taking all the time and placed on, there's a conception that we don't want there to be a lot of stomach acid. And reflux isn't really low stomach acid. It's just stomach acid in the wrong place. Your LES sphincter goes up and you don't want the acid in your esophagus, but you actually do want a good amount of stomach acid. So that is one factor as we age that does go down. And when your stomach doesn't have as much acid, you can't digest your proteins as well, because that's the purpose of the stomach acid. And there can be larger particles of food that then are in your intestines, which can make the bacteria grow more. So if they have more fodder to eat.
Wow. So when it comes to eating, then if someone can't really if we were just gonna start talking about, if you suggest to someone to eat the rainbow, right, for example, what if they have a hard time getting that in every day, right? And I think some people have even trouble, I think not eating enough fiber and not even enough vegetables. So what would you suggest? Would you suggest them getting a probiotic usually, or?
You mean if you're saying that they struggle to get the right foods in. So, I would say that you could take see, you have to be really careful. So, I keep putting caveats on, I feel like, but you want to make sure you're getting a high quality. If you're going to do something like that, you do want to make sure you're getting a high quality probiotic, because there isn't as much, medication are tested by the FDA. So you do have a certain standard that you have to follow for medication, where supplements don't have the same standards. So just I do want people to make sure whenever, that they are getting a high quality one, not just, because you can pick something up and it may not, unless you really understand all the practices, it may not be, you may not even be getting what you want to get out of it. So, so you're saying just as a general tip to improve, to feel like you want to do something for yourself, but you're not great about getting the foods in that you need to.
Yeah, I know that a lot of my clients have a hard time just eating enough, right? So, I mean, with all good intention, it is people just get too busy to eat. And I know that sounds crazy, because food is 90% of our health, right? So, but there are people that just can't get all the nutrients that they need coming from their food. So where can they get that additional
Yeah, they
support?
do make some, so they do, so like you could try like a good so you can try the probiotic, you could try like a good, if you're looking to get like good nutrients, you can try like a good quality protein shake. That would be something that would get amino acids in you and get some proteins. They even do make some of those mixes. If another thing I like to tell people is if you're like that and you're trying to get a lot of, if you want to get more vegetables and different fiber and things, to do a smoothie, because you can do that really quick and you can take that with you. I actually went through a period where I would make a big thing of smoothies and then I'd freeze them in mason jars for the week. And I pull out my mason jar every morning and then take it to work with me, and just let it thaw through the day, because I knew like, okay, I'm getting this dose of, so, and I mean, there's great smoothie recipes. I'm sure you can go on even on Pinterest and find really good, healthy smoothie recipes. But that way, I feel like that's a quick way to get something in that's a good variety, and you can get you can aim to get what you want in that too. So.
Absolutely. I completely agree with you. And I share that as well. And I love your idea about the mason jar, freezing that up. I actually create little baggies of like what I want to put in my smoothies. And I leave, well, back in the day when I did work at the office and all that, I would leave a little blender and I would actually just go in and just mix it in the office. And people are like, what are you doing? I'm like, I'm having my breakfast. That's perfect. Yeah, I agree with you. I think smoothie is a great way to get everything that you need to get in. Yeah, I love that. So does caffeine affect the gut? Like if someone like drinks alcohol and caffeine, like what are kind of the effects of that on gut health?
Yeah, sure. So alcohol can be inflammatory. So you do want to worry about the alcohol can lead to, probably most people by now have heard the term leaky gut. So leaky gut is whenever the membrane, it's another issue. So we talked about dysbiosis, and that's the overgrowth of the bacteria, but you can also then lead to leaky gut. And that's when you take like this, think of your stomach like a cheesecloth, like your gut lining. And if the tears in that cheesecloth get too big, then particles of food can get into your bloodstream, and it sets off an immune reaction. Your immune system's like, alert, alert. We weren't expecting this to be here. We think it's a foreign invader. And that's kind of the dynamic, simplified, what happens in leaky gut. And so excess alcohol intake can actually cause leaky gut and lead to that dynamic. So you just want like, that's, just because it also can cause like, because it's processed through the liver, if it causes any liver sort of impairment. We also make our bile in the liver, and that bile is how we digest, is how we break down fats. That goes through the liver into the gallbladder and helps you break down your fats. So, that also helps, that also can impede your digestion in that way. So, those are two things that we want to be careful of: alcohol and excess. Caffeine is more, everyone metabolizes caffeine. Another thing we can do these days is do genetic testing. It's really amazing. There's so many different tests that you can find anything, most anything you want about yourself now. It's really neat. But we can, see how you metabolize caffeine too, because everyone metabolizes different. And we can all tell, like you may have a cup of coffee in the morning and feel fine. And I may feel jittery. But so we all do that. So if you have it can actually increase your motility. To the extreme, it could cause people to have diarrhea if it increases too much motility, hypes you up too much. But that will kind of vary from person to person on how you metabolize caffeine.
Wow. And how can people tell whether they have an unhealthy gut?
So we do, my favorite test is a stool test. So we're getting progressive here. I say what we can do is when we do that test, we can actually look at all the your whole microbiome. So we can look at all the different bacteria that are in your gut and see all the levels of your good ones, the bad ones. We can look at your pancreatic enzyme function, your gut lining, how you're breaking down fats. So it gives us like a very clear picture of what's going on. And then that way, once we do that, then we can treat it specifically the way the way you need it treated based on what you have going on. But I think that, I guess if you feel like if you think you have gut issues, I think that would be advised to go see, a functional medicine practitioner or someone like that could actually do some testing for you and kind of personalize the treatment to what you have going on.
That's a really good point. What are some of the, I guess, before someone would even know that they would need to go see someone like a functional medicine doctor, like how would they know? What are some of the symptoms? I think you mentioned some of them already, like kind of like the skin problems, the fogginess, the brain fogginess.
Yeah. So you're going to first have the gut symptoms. So like if you feel like bloated, if you feel really full after, if you're eating a meal and you feel like, oh, every time I eat, I just feel full. I look like I have, I'm bloated, especially, if there's a few hours after, if you're, have belching, like any gas, diarrhea, constipation, heartburn. And we can see like dramatic changes in a lot of those things. So those would be your main IBS, things like that, your main GI symptoms. But then you also want to do like, if you're, if you feel like you're exhausted all the time, if you keep getting, sick, and eczema and acne are things that can often present from the gut, headaches, you just feel, so it's just sort of like the aching, sometimes like even joint aches, like some of those overall non-specific things that you're like, I just don't feel well, where you're not anything is wrong necessarily, but you're just kind of wiped out and you don't feel well. Could be a chance that you have like an underlying effect, like something going on in your gut.
Thank you for sharing all that. That's really, I think a lot of us kind of go through these symptoms and we kind of brush it off, or we don't really pay attention to it, or sometimes they kind of like overlap with other things that we're going through, and we just think that, oh, it's because of time of the month, but really taking the time and being empowered to make decisions to go seek a professional, to get the testing, to really get to the root cause of it, versus kind of just hearing or listening to what someone says and just like trying this out or trying different things out without really sticking to something consistently, right? Without actually knowing what the problem is. So I love how you mentioned all that.
And the other thing is too, that is like the Hashimoto's and autoimmunity. Usually there's a gut connection with autoimmunity, with autoimmune situations too. Yeah.
Wow. So what do you think is like the biggest myth buster that you want to clear up for us?
I think probably what people are most surprised about is the low stomach acid, is that you don't need low stomach acid. Actually, you want to have sufficient stomach acid in order to really digest your foods. I feel like because of that, we hear so much about like Prilosec and Prevacid and things, and we can even buy them over the counter, that people just take that and feel like, oh, I should have that. But actually having that low stomach acid for a long period of time is not good for your health. It actually can create a lot of unfortunate dynamics for people. So, I'm trying to actually support it in a natural way and bring that stomach acid back up and heal everything. And some of those proton pump inhibitors really can create more problems for patients in the long run. So I think it just takes some time to really realize like, oh, wait, I don't, that's not a bad thing. It's just, stomach acid in the wrong place. Because a lot of people suffer from reflux and feel like, oh, that's
what I mean. Yeah, they just things come up and they're like, oh, but I mean, thanks for clearing that up for us. That's awesome. It's good to share that. What do you think is the best advice or the worst advice that you've ever received when it comes to what you're working with? So some of your mentors or people you've come across.
That's a good.
I like just throw you off a little bit there with one of those. Has there ever been kind of like, I think we hear advice all the time from different people, especially now. Everyone's just surfacing online. The world is just, we hear outside noise a lot. So there's a lot of things that get filtered in. Is there kind of like something that you've heard that stuck with you that was really good?
Just in general advice that one time someone told me was that, things will always change. So I think sometimes, and this isn't necessarily reflective of functional medicine specifically, but I think in this past year, we have seen, sometimes that's good and sometimes that's bad, but we know that it will change. So when you're in it was a situation where I was upset about something and someone said, the one thing you can always count on is that things will change. And so, and I was like, yeah.
The only constant is change.
What?
The only constant is change.
Yeah. And I think when you find that through your life and whether sometimes you're in that like great space where you like don't want it to change and it will, or you're in a situation where you'd like it to, it will. And just being like knowing that and accepting it and riding it out is always, a good thing. And I think we saw that this past year for sure, where the world flipped upside down and we're all okay. So we moved on, people had to make changes and maybe some grudgingly, but some were really positive. I think with my practice, I was telling someone today, like I have a physical space, but I have more of my practice online. I see people virtually, so I can see people from all over the world. I talked to someone this week from Sweden. It was, it's amazing to even be able to be international, where you can work with anyone. And I think that that's really an amazing thing that's come out of all of this change, that you don't have to be in the same physical space to be able to make a difference for people and help. So that is, it's been quite a year, but some really good things.
I agree. That's beautiful. I'm so happy that you mentioned that. And I think it tied into what I wanted to ask you about what you learned yourself this past year. And it sounds like it tied into like this device that you're talking about, right? That the only constant is change. And it's so true that we've all come out of a very, very challenging year and a half, but I think it birthed a lot of opportunities for us and a lot of things that we wouldn't have had been able to encounter had it not been what happened. Exactly. So I love that, we are able to kind of grow. And to be honest with you, I was able to meet you because of this past year and a half. So I'm so grateful for that. I'm so happy. I'm honestly so grateful for you being here. I have a couple of more questions left, a couple of more fun ones. I would love to get to know you more. I'm really big on books. I think that especially in the personal development, the self-growth, I know that you posted something recently on your, I think your Instagram of you reading books too. You're really big on books as well. Yes. So I would want to hear what was like the one book that changed your life, or what was one of your favorite books? Love to hear from you about that.
Yeah, absolutely. So I am a big reader. I do love to read and love to get to gain knowledge. I did the success factors. I don't know whether you've ever done that test, but your gifts, and one of mine is a learner. So I'm always trying to get more information. I would say that I read Brene Brown's Gifts of Imperfection at a time where I really needed it. And so I feel like I have, shared that book with a lot of people and recommended it, because I think we're all, I'm a for sure recovering perfectionist. I feel like that's something that we want to be able to do it all, and we want to, be the best mother we can and have a career and, be able to bake cookies for the bake sale and still work, and have your own space. And I feel like a lot of women struggle with feeling like they can't live up to everything they need to be doing. And so I feel like that book, have you read the book Gifts of Imperfection?
No, I've heard of it. I love recommendations. The thing with me right now is I'm trying to get through 10 pages a day. That's my goal of a book. So I've even done like the Audible and all that stuff, but then I love the podcast. So I'm just trying to prioritize which one to do. I could start like 10 books at the same time. 10 page there, but I am definitely putting that on my list as well. Love that recommendation.
It's amazing though. I do agree with you when you're saying that, because we're bombarded with so much information that it's wonderful, but then it's like, okay, you got to focus on where's my priority right now.
Yes. I'm just actually going through the comments right now. I just did like a refresh. So I'm just getting some people coming through. Hi, Jasmine. Hi, Emily. Hi, Daisy. I think I had some comments about, about the supplement, how it might be high quality and watch out for the fillers.
Yes.
And then someone commented and said that these are great alternatives to try, really helpful alternatives, I guess, for if you're not able to get full all the nutrients in that we need. Emily said to-go bags, they love it, great time saver. A lot of people love the smoothies. someone's having one right now. And yeah, and then to your previous point about the cheesecloth, the amazing description that you used really helps you picture the issues that are going on. And honestly, you gave some really, really good examples of how people can look at it, because sometimes when it comes to health and when it comes to gut health, it can get really technical. Mm-hmm. And I love the way that you even described the probiotic and the prebiotic. I look at it like the prebiotic fuels the probiotic, right? And the way the lawnmower and all that was such a great description. So amazing. I love how you just simplified everything.
Oh, thank you.
So last question is, what are some of, because I know there's so many things that are happening, going on. What are some exciting projects that you can share with us that you're working on? And how can our audience find out and learn more about you? And yeah, they want to work with you too, all that information.
Yes. So my website is www.megmill.com. And I'm also over on Instagram at Dr. Meg Mill. It's just DrMegmill. So I'm regularly on there posting things. I try to give little health information. So even if you can follow that and get some things that you can put into your regular routine. And if you'd love to, I do free consultations. So if you ever are questioning if you would be a good fit or if this was something that's worked for you, I think that's the best way to really talk and see what you have going on and learn more about like what I do and how I can help. I also really work with a lot of women. A lot of women suffer from headaches regularly. So I've seen like really dramatic results with people having migraines regularly for years and being on, migraine medication daily and everything to being completely headache free. And it's been pretty dramatic with a lot of my patients. And it was just something that kept coming up over and over. I have a huge passion for gut health, but it also was something that just kept, I kept seeing like, wow, we're making a difference. So I'm working on starting a group program with women that are suffering from headaches. Will be, I'm thinking it's in the works, but I think a 12-week program where we meet once a week and through a group, because it kind of some of the same things you can do to make, some things that are specific for that area. And that's something that we can do in a little bit, maybe more of a group space than you can with some of these other things that we have to really dig into more testing. So I have that coming up, and I created a Facebook group called the Headache Healing Club. So that's over on Facebook. If you're someone who suffers from headaches regularly, that will be coming out too.
Oh, amazing.
Then that cycle where you have the headache, and you're taking the Advil, and the Advil's affecting your gut, and then your gut.
Yeah. It's so true. That's a really good. I think a lot of people, they tend to go to the medication, right, as soon as they get a headache, and then it just accumulates. And I can just think of like several people right now that comes top of mind that actually talk about extreme headaches on the daily.
Yeah,
right? Like the migraines.
It can affect your life so much. So it's like, I've just seen that has been really dramatic for, a good bit of my patients. So that's why I've been, trying to get this out to kind of reach a little bit like a broader range with that to help people.
Well, let me know. I'm definitely going to put all your information, everything you just said. I'm going to link it in the description to everything. This will also be, saved as a replay for the people that weren't able to join us live. I'm just so grateful for you being here and just doing what you're doing, helping so many people with things that just on the daily could be very debilitating for them. So thank you so much for taking the time out and talking to our group. And for anyone that wants to reach out to Dr. Meg Mill, I'm going to have all the information in the description below. If you have any questions and you guys were not able to get it answered or weren't able to make the live, I'm going to post everything for you, and we'll revisit. And then Dr. Meg Mill and I will be in touch for sure. So thank you.
It's been a pleasure. Thank you for inviting me in the conversation, and thank you so much.
It's been so fun. Thank you, Dr. Meg Mill. I'll talk to you later.
Thank you. Okay. Good night.
Bye.
Bye. Thanks.